venous disease can limit someone's quality of life, and there are some important symptoms that you need to look out for. Dr. Greg Martin with RIA Endovascular is here to tell us more about their non-invasive treatments.
Dr. Martin, it's so awesome to have you here on Colorado and Company. You're an interventional radiologist, so tell us what that is.
So an interventional radiologist can be thought of as a minimally invasive surgeon. What we do is perform procedures that previously required open surgery. Now with technology, we can do things that previously would have taken days to recover from, can now be recovered in the same day.
Wow, that's great. And and many of us don't want to have that downtime. So same days is really great for a lot of us. Is there a particular procedure that you wanted to talk about today on Co&Co?
Absolutely. More than just a predictive procedure, I'd like to talk about venous care and veins for our patients today. That is something we specialize in and have a passion for treating.
What are the symptoms of venous disease that we should be looking out for?
Yeah, most people, when they think of the venous disease, it's someone points to a vein in their leg and says, oh, I hate this vein that pokes out of my leg. And that is a part of venous disease, but it's much more than that. People who have venous disease can develop rashes, they can get chronic leg swelling, chronic leg heaviness, even chronic leg pain and ulcers. It can be a severe disease for people that can limit their activities of daily living and limit their lifestyle overall.
Yeah, and obviously this is something that we should maybe be concerned about if we're seeing any of these symptoms. If these symptoms cause major problems and are left untreated, can any of these symptoms cause major problems if left untreated, especially because, again, if we have some of these symptoms, I'm sure we need to be worried.
Yeah, for most people, it is more of a bothersome type of thing, but we treat a lot of patients who, from their venous disease, have developed wounds and sores that don't get better, and don't get better until we treat their venous disease. Luckily, that doesn't happen often, but it's something that if someone has a sore wound that isn't getting better, thinking about the veins can be very helpful for them.
So tell us more about varicose veins and the types of veins that you guys treat and then how you treat them.
Yeah, so varicose veins are the superficial veins in the leg. Now, you also have deep veins that run deep inside the muscle, and those return the vast majority of the blood flow from your legs to your heart. But the superficial veins can cause us problems. And what happens with superficial veins is they can get enlarged and they can get what we call reflux or leaky. And what that means is that those veins, instead of returning blood to the heart, they basically cause the blood to stay in place. And when the blood just sits in the leg, it starts to leak out, or fluid can leak out in the leg and cause leg swelling and cause all the symptoms we have already talked about. So what do we do about this? The important thing for these superficial veins is that when they are causing you problems, you no longer really need them. In fact, they're causing you problems. So our goal is to redirect the blood flow into those good deep veins that you have. And we use minimally invasive techniques in our office to help redirect this blood flow so that those problems such as swelling, rashes, those will improve quite rapidly when you take care of these abnormal veins.
Okay. And, Dr. Martin, there are a lot of vein centers out there. So why does RIA stand out? Why should we really be considering RIA?
Yeah, thanks for asking that question. What I think we really are strong in is our ability to take care of the whole patient. We don't treat just veins, we treat the whole body. And so when we see a patient who comes in with leg swelling, we're able to address multiple reasons of why they may have this swelling. And when we do treat the veins, we treat the veins in a very efficient, and our goal is only for the benefit of the patients.
Excellent. And, just piggybacking off of that for a second, for you, how does it feel when you treat these patients and you see their, lives start to improve, you see them smiling and so happy? How does it feel for you?
I love treating veins. I especially like treating veins that are causing people problems. When they say, yeah, I couldn't stand and do my job for a couple hours because my legs would just swell and I had to sit down and raise them, and now I can work and I can do the activities I want to do, that is fantastic. When someone comes in with a wound that hasn't healed in 6 months and I do a procedure and that wound goes away in 2 weeks, that is so satisfying, and those patients are so happy.
So great. And so, Dr. Martin, if we wanted to reach out to you guys, where can we find you?
Yeah, we have 2 clinics. One is in Denver and one is in Northern Colorado. That can also be, our information can also be found on riaendovascular.com.
Dr. Martin, thank you so much for joining us on Co&Co and giving so many people such better quality of life. We appreciate you.
Thank you for having me.
The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. If you feel like you're suffering from any of the symptoms related